Okay, go.
COVID from Two Sides by
Manveer Singh.
Joseph Arias.
And Jacob Baum.
Biden's six-part plan to protect the citizens. President Biden believes that decreasing the number of COVID cases requires people to come together and wear masks. First of all, Biden has set up a six-part plan to help reduce the risk of getting COVID and help students achieve their education. In the linked article, President Biden mentioned, as I've said before, we have the tools to beat COVID 19 if we come together as a country and use the tools we have. In this quote, President Biden talks about the six-part plan he laid out during September 2021. President Biden is referring to tools such as masks and vaccinations provided for the people. He also mentions vaccinating those who have not been vaccinated as a part of a six-part plan. Some of the other key parts include vaccinating the people and keeping them protected, keeping children safe and schools open, increasing testing and masking, protecting the economy, and providing care for people with COVID 19. President Biden alerted the entire nation and mentioned the dark winter as an example. Dark winter is a synonym for the illness coronavirus is causing worldwide. On Thursday, Biden proposed a six-point plan to increase vaccines, enhances access to testing, and expand the availability of coronavirus therapies. According to administration officials, the new rules will affect nearly 100 million people, or two-thirds of workers at the United States. A Republican by the name Mike Lee spoke on Joe Biden's six-part plan. He stated, from ignoring property rights to shirking his duty at the border, and now coercing private citizens to undergo a medical procedure, Joe Biden has shown a wanton disregard for the U.S. Constitution. As a would-be autocrat, Biden endangers the very fibers of the great nation. Freedom and agency are the hallmarks of all American experiment. Mike Lee states that President Joe Biden is disregarding the U.S. Constitution and forcing people to take vaccines. Lee presented legislation on Tuesday that would allow for exemptions based on personal belief and for other purposes. He claimed the measure would make an exception for those who honestly believe they should not obtain the COVID 19 vaccine due to religion or anything.
Democrats' view on a mask mandate. Dr. Anthony Fauci, the government's top infectious disease specialist, and Dr. Scott Gottlieb, a former commissioner of the Food and Drug Administration under President Trump, have both said it's time to seriously examine a national mandate to stop the virus from spreading. Experts say there is mounting evidence that the face mask can significantly prevent the transmission of respiratory viruses like the one that caused COVID 19. Even if wearing a mask does not prevent infection, some experts believe it can lessen the severity of disease by reducing the intensity of a person's virus exposure. According to research, states that enacted mask laws saw decreased COVID 19 growth rates from the day the mask mandate was enacted. Researchers from the University of Washington's Institute for Health Metrics and Evaluation estimated that universal mask use, when 95% of people wear masks in public, could prevent nearly 130,000 deaths from COVID 19 in the coming months. Although those figures are based on certain assumptions and can change if people's behavior changes. According to the Institute's research, only 69% of Americans currently use masks. Some public health specialists worry that Trump, who mocks Biden for wearing masks, and whose aides frequently forego them, even as the White House has become a coronavirus hotspot, has tainted the mask mandate to the point where wearing one will always be seen as a political statement. Republicans' view on a mask mandate. Almost 2 years after the outbreak and the supply of remedies, vaccines, and innate immunity created by an environment where the slight benefits of wearing a mask do not outweigh the risks. Despite the fact that approximately 80% of Americans over the age of 12 have at least one vaccine shot and a nationwide testing positivity rate of around 5%, we continue to live in a self-created atmosphere where isolation, sterilization, and mysophobia are not only acceptable, but encouraged. Children wear face masks in school, but can remove them for naps and meals. As though the virus is aware of these boundaries, it isn't the case. The same thing happens in movies, aircrafts, and restaurants.
Trump has claimed multiple times that Obama has left him nothing and is the reason his pandemic response has a lack of emergency supplies. Formal federal officials argue that Trump was the one who didn't start stocking up at first signs of the pandemic. Dr. Nicole Lurie, former assistant of Secretary of Health and Human Services for Preparedness and Response under Obama, said that it isn't accurate of shelves being empty. A strategic national stockpile warehouse was described as a massive warehouse with rows of supplies, including ventilators. It noted a locked section for addictive medicines and a freezer full of temperature-controlled supplies. According to the report, an official valued the stockpile at $7 billion. Officials didn't say it wasn't as full as they hoped, but budget cuts did deplete the stockpile by $85 million. Lurie said that the Obama administration had left a crucial contract in place to speed the production of masks, but that contract was dropped after Trump took office in 2017. Another plan created under the Obama administration that would have been developed, reusable mask, was deployed too late to boost current efforts, she said. The stockpile was very definitely there when we left office in January 2017, Johnson said. It should not have been where it could have been due to budget cuts by the Congress, but the stockpile was definitely there. President Trump had repeatedly claimed that his administration inherited an empty national stockpile, most recently telling ABC News' David Muir earlier this month that the last administration left us nothing. Johnson said that the Obama administration had been focused on the national stockpile after the Ebola outbreak in 2014, and that they had, in fact, discussed the state of national stockpile with the incoming administration. Dealing with a lethal pandemic like this has been and was uppermost on our minds, Johnson asserted, and the Obama administration, given the experience we had with the Ebola and other things, it was one of the very few things that we talked to the incoming administration about as we were leaving office.